What's up, YouTube? Welcome to another episode of the Undergrad Forum. Now, in this video, we're going to talk about what if you don't get excited like everyone else about all the things that happens in medicine. You know, if you're on your OB-GYN rotation, everyone's like, okay, you saw the birth of a baby. You really better be excited and have this amazing heartfelt feeling. Or, you were in the ICU and a patient passed and you're supposed to be absolutely broken and need to talk to people or whatever else. Or whatever happens at any stage in medical school, there's a general community response that people seem to expect from you. And my thing here is, what if you don't feel that? What do you do then? And the reason I bring this up is a lot of people, so now that I'm senior resident, I have a lot of junior residents, but I have a lot of med students as well on rotation. And they all talk about the same thing. We go down to the ED, they call a stroke code. Someone's obviously not doing well, they can't speak well, they can't move a side of their body, whatever have you. We're thinking about pushing TPA. And, some students are very affected by it. Some juniors, some interns, they're like, oh my God, this person's got a left MCA, they're not speaking, they're not moving the right side of their body. They're this is very painful to them. They can be family around the patient around these times, crying and panicking, and you got to kind of manage that as well. And what happens in these situations, we're using a pure neuro example because that's kind of my life. You got some students and some interns and juniors who are very affected by it, and then you have other people who just aren't. Okay, yeah, looks like a left MCA. Are they in the window? Should we, is there a thrombectomy candidate? They're very focused on that as well, and some people are very focused on the emotional component, obviously in addition to the science. And the question is, this comes up a lot because I'll kind of get pulled aside by one of the interns or juniors or med students and they kind of want to talk about it. And really I get people who talk about it with me on both sides. On one hand, you have people who say, I'm really affected by it. This is a big deal to me. They want to kind of talk about it. And I would say that's a very traditional response. People are impacted by things that happen in medicine. It's probably new to them. It's very emotional, whether it's, in other situations, the birth of your first baby that you see in OB-GYN, and that can be very emotional, or the passing of a patient who is very critically ill in the ICU, or a stroke patient here who we're trying to push TPA on. These can impact people. And that's a very common conversation that I have with the juniors and med students regarding what it means and how we have to manage the family plus the patient. That's very routine. And if you feel like that, that's fine. That's completely normal. Now, the other point is, what if you don't feel like that? What if when you saw your first baby delivered, you weren't oh my God, you're oh, okay, baby got delivered. Or when someone passed away in the ICU, you were okay, they were sick, they passed. Or, someone comes in with a left MCA, you're oh, okay, looks like a left MCA, let's move on. What about that? And I also get a lot of students who are like that, and they come up to me, and time after time is the whole reason I'm making this video. People come up to me, med students and juniors, who are hey man, I didn't get the same big emotional response as other people. Is something wrong with me? What do I do? And my answer to them is always the same. No, dude, don't worry. You're completely normal no matter how you feel. There's no stereotyped expected response that we have from people. You feel however you feel, and you feel confident about that, okay? It's who you are, you can't change that. So what you can do in this case is, if you're, say you're seeing the birth of a baby for the first time as a med student, and maybe it didn't strike you as too awe-inspiring or wow, that's okay. Just keep it to yourself. You don't have to go around telling everyone, oh, I wasn't impressed or whatever, just keep it to yourself and, be polite. And if, the senior resident or whoever maybe is delivering the baby with you, and, they kind of want you to share some experience, if you see they're happy, share in their happiness as well. You don't have to have a whole, oh my God, this is amazing response. You can just be normal, but just be polite. And that's okay, or if we're down there in the ED and we're trying to push TPA and families crying because the parents, not speaking right now as a patient, that's okay. You don't have to be quiet down, I'm not impressed by this. You could just be yeah, I know it's really tough, support the family, support the patient. Again, you don't have to have this crazy emotional response. You can just be whatever you are. So don't worry about it. However you feel is however you feel. It blows my mind that people feel that they need to do something and to be in the general consensus of how the community is feeling. No way, no way. You feel however you feel. If you're excited, you have positive emotion, great, embrace it. If you're a little bit more indifferent or it's not sparking some big emotional excitement into you, that's okay as well. Embrace whoever you are, embrace whatever you feel in medicine, or even in life. You know, if things are going on and you don't have the same emotional response or same feeling as other people, that's okay. Just be who you are, be true to yourself, and reflect and make sure what you're feeling you think is like healthy and safe, and go on with yourself. Nothing to worry about. And that's what I tell all my juniors and med students. Don't worry about what other people are doing. Worry just about yourself. If you're content and you're happy about what you feel, that's all that matters. How everyone else feels is their thing. You focus on yourself. All right, guys, let me know what you think. You know, there's a lot going on in medicine. It's a very emotional field. There's lots of ups and downs, and you're very involved in it as the med student, physician, or resident, or whatever you have you. So let me know what you guys think. Have you had a moment in time where maybe you didn't feel the same way everyone else did and you kind of just kept to yourself? Or what are your thoughts? Drop it down in the comment section below. I read them all. I try to thumb them up or down, comment on them. I try to heart them. You know, I read them all. I love to hear what you guys think. You know, remember, just stay true to yourself. Do whatever you want. It's your life. Live with yourself at the end of the day. You know, that's most important. Don't worry about other people. All right, guys, hope you enjoyed this video. And as always, enjoy your studies.